Hi, my name is Janiyah Jones, and today I'll be discussing the effects of uterine myoma on the female reproductive system, also known as fibroids. So, first going into the anatomy of the female reproductive system, there are five main components and parts of the female reproductive system that include the vagina, cervix, uterus, fallopian tubes, and ovaries. The vagina, also referred to as the birth canal. The cervix plays an incredible part with just cleaning and helping the vagina stay healthy, and the reproductive system as a whole, keeping out bacteria and other things. The uterus is what houses the fetus for 9 months, helping to feed and nourish the fetus. The fallopian tubes are basically help to facilitate a fertilized egg to reach the uterine wall for implantation, and the ovaries are where the female eggs are housed and produced. So what are fibroids? Fibroids are basically small non-cancerous or cancerous growths. 9 times out of 10, they're going to be non-cancerous. They begin to grow within the walls, inside the walls of the uterus, or the subserosal layers of the uterus, meaning the outside. The causes for these growths are very unknown. There are many predisposing factors that makes the person more susceptible to getting fibroids. Uterine fibroids, they're the most common type of tumor found within the reproductive system. These fibroids can grow at many different rates and many different sizes also. Some can be the size of apple seed, or some can be as big as a small watermelon. It all depends. Fibroids are most common in ages ranging from 30s to 40s and up to menopause. Obviously, anybody is susceptible to having a fibroid in that case. There are many different tests that can be ran to detect uterine fibroids. This can be done using a transvaginal ultrasound, which basically is basically an ultrasound. It's another method of it. This can be done by a doctor or from an ultrasound technician. An MRI test can be ran, or also a blood test. If a woman is coming in to see her doctor and has signs of anemia, a doctor can also run blood tests, and this can be a clear sign and detection of lots of blood loss, because heavy menstrual bleeding is a sign of uterine fibroids. So this can cause a doctor to do more investigating in that sense. Signs that someone may be suffering from uterine fibroids. Like I said, this can range from heavy bleeding, pelvic pressure, depending on where the location of the fibroid is. If it's putting pressure on the pelvic area, it can be putting pressure on the bladder, or it can be in the back of the uterus, putting pressure on the rectum. So this can cause frequent urination, difficulty emptying the bladder, constipation, and also back aches or leg pain. So what factors may predispose someone to getting fibroids? Like I said, the cause of fibroids are really unknown, but there are kind of a little bit of linkage, like I said, age, women who are within their 30s and 40s up until menopause. Most of the time when menopause hits, fibroids are very least likely to occur. And if a woman does have fibroids after menopausal, most likely those fibroids are very likely to shrink. Family history, if someone has a history of one of their other family members having fibroids. Ethnic background, most likely African Americans are more susceptible to having fibroids than any other ethnicity, obesity, and vitamin D deficiency. So where can these tumors grow within the uterus? There are 4 different types of fibroids that can grow within the uterus. These include submucosal fibroids, which these are going to grow just under the uterine lining. The intramural or myometrial, these are within the uterine wall or the uterine muscle wall. The subserosal, these are just outside the uterus lining. And the pedunculated fibroids, these most likely or will have a stalk on these. These can grow outside on the subserosal layer, or they can grow within the uterine cavity. These, like I said, these are most likely can be detected or seen because they have a stalk growing from them. So long-term implications of having uterine fibroids, there aren't a lot of long-term implications from having these fibroids. If a person wants to get these removed, they can. If they choose to live with them, they can. But there can be changes in infertility and pregnancy. Infertility being if a fibroid is growing within that uterine cavity, it can be hard for an egg to implant itself within on the uterus because that fibroid might be interfering with implantation. Very heavy or lighter periods and anemia from heavy blood loss. So now we're going to go into treatment options. So there are common treatments for uterine fibroids that will include a hysterectomy, which is basically the removal of the uterus itself, hormone therapy, a myomectomy, which is basically the removal of just the fibroid itself, the endometrial ablation, which is basically destroying the lining of the uterus, making it thinner, or myolysis, which is basically when they're going to insert a needle within the fibroid. This destroys the fibroid with electrocution or by method of freezing the tumor. And here are my references. Thank you so much for listening to my presentation on the effects of uterine myoma on the female reproductive system.